Thanks. So excited to be here, excited to be announcing our partnership with Cypress. I think what HealthJoy saw when we looked at the healthcare market is prices are exploding. We've been talking about it for the last day and a half. Those prices are largely growing for employers and employees. They're the folks that are paying for the consumption. When we look at what's going on with your employees, their paycheck is not increasing at the same rate. So we have an issue here that really needs to be solved. If our healthcare continues to rise at these rates, it's going to go from our top expense, or our second highest expense, to our highest expense. It's going to put more employees at severe financial risk, which obviously in turn puts your companies at risk. And I think another thing that we see from this is all of these prices are driven by consumer behavior. Even though we've created a really complex healthcare system in America, it's still a consumer-driven economy. And I think what we've heard a lot about is how do we change the outcomes of healthcare starting from the supply side? How do we make certain procedures more cost-effective? How do we design a system that takes networks out of the equation? Where we really focused was on the member. If consumers are driving these price increases, how can we get in front of members and change their behavior? So with that in mind, we started thinking about, all right, what does a company care about when they're designing their benefits package? Ultimately, they care about their financial risk and how much their employees value these benefits that we're all investing into. And the attributes of members that drive these outcomes really are quite simple. It's how healthy are people, how much are they going to consume year in and year out, and how engaged are they with their benefits? Are they using preventative care? Are we catching diseases early because our whole population's seeing a PCP every year? Are folks using our plan the way it was designed to be used? I think Healthcare Blue Book is a great solution. MD Save is a great solution, but all of those things require that a member realizes they're there. So the more engaged a member is, the more logical they're going to behave, the better decisions they're going to make. And so if we can drive people to be more healthy and more engaged with their benefits, we're going to have better outcomes as a system. So from there, we started thinking about, okay, what's the member experience today? How do we engage people? And I think the answer we repeatedly heard was, well, we have an enrollment process. We give people benefits booklets. We include all the phone numbers in those booklets. We put some of those phone numbers on their medical ID cards. And really from there, we hope, it's kind of a hope that 40-page booklet is in their car when they need help. It's in their back pocket. And that when they call one of those phone numbers, they're not encountered by a 15, 30-minute wait time, or that they're going online and remembering these numbers of passwords and apps that they need to remember and logins, and they're navigating these portals that look like they were built in the 90s. And so really, kind of holistically, what we're giving people today is a really disjointed, confusing experience. And then when you put on top of that the incredibly complex system that we built with hitting costs all over the place, we're putting a whole lot on our members with the hopes that they're going to be the ones that drive our outcomes so that either our premiums next year don't go up or we're not hitting our stop-loss limits. And so, this is just a big risk that we're leaving on the table. We're expecting a lot from our people, especially when we compare this to what's going on in other industries. You look at what Amazon did to retail. They didn't do anything to change what retail used to be. They changed the scope of what retail was. They brought a digital experience that allowed you to shop at any time you wanted to. It allowed you to compare the prices of Macy's to JCPenney to Polo right on a computer screen, instead of the expectation that you go to a mall and you walk into the store and say, I want a white polo shirt, I'm going to look at Macy's, I'm going to go over to JCPenney. No one did that. So really what Amazon did to this industry was they changed the scope of service. They brought a digital experience to it that continued to become more personalized as they learned about you. They give you a simple interface to interact with. And They give you easy access, really on your terms. You decide when you interact with Amazon. Similarly, Uber did the exact same thing. We all still get in a car and are taken from one spot to another when we use Uber. What they changed was, how do you order an Uber? Do you know when the taxi is going to show up? How are you going to pay for it? It's all simple. So really this ease of use concept is something that we can learn from other industries in terms of how we treat healthcare. And I think another thing that we thought about, just a quick question for everyone, how many folks have looked at their phone today? What about since I started talking? All right, I'll take that as I should. Back in 2005, this is the inauguration of a pope. This is what that picture looked like. This is still a little dated, but in 2013, that's what the next inauguration, or I don't think that's an inauguration, but something. So obviously, mobile devices are the way that we can reach people. It's a trend that's been growing over the past decade and a half, and it's something that we expect to continue. So we thought about what is the best medium that we can provide a better healthcare experience to people through, and it was clearly a mobile experience. So I'm going to just share a little bit about our application. A core concept of ours is that we need a centralized access. Right now, most benefits packages are made up of at least 5 different solutions. If you're unbundling and working with reference-based pricing, you may have a lot more in there and a lot more complexity that you're expecting your members to navigate. Through our integration with the plan designs that you offer, as well as the eligibility file, we can map each member to the elections that they make. And through that mapping, we can build out a personalized benefits wallet. In this benefits wallet, they'll have all of their ID cards. We track medical spend, so their deductible information, their out-of-pocket limits is all within the application. We integrate with financial institutions, so if you're offering a 401k plan or a health savings account, a member in one of these cards can see their HSA balances. They can see their 401k balances. They can even get notifications when you guys contribute to these accounts, really bringing awareness to what you as employers are investing into your employees. From there, I think our healthcare system has proven to be too complicated to just give folks a tool and expect them to own the experience on their own. And so what we built is an application that combines telemedicine with a virtual assistant, a technology, as well as a concierge team so that we can be there to guide people through their choices. I'll just kind of walk through what members have access to from this menu, which really does address the scope of the types of decisions people need to make on a day-to-day basis when they're interacting with their healthcare. So at the top there, you see telemedicine. That is something that's fully integrated into our platform. So when a member selects that, they're taken through a short intake process so that we can initiate that telemedicine visit. It's 9 questions. From there, a member just has to sit and wait for a phone call. Usually takes less than 10 minutes. If somebody comes into our application, let's say to find a facility, and they tell us they're going to an urgent care, our virtual assistant, Joy, is going to make sure that she reminds that person that they have access to telemedicine so that we're really addressing this point of care decision-making process that people go through, often from an uninformed standpoint. When we steer people to providers and facilities, we're integrated into the plan designs, again, that you're offering. So if you're doing direct contracting, we're going to make sure we're taking that into account. We're integrated with the network information. We're integrated with CMS data. We also work with a couple third-party providers. That information allows us to, 1, guide people based on cost and quality of care, but also 2, our virtual assistant is going to spend the time to ask the member what they care about when they're receiving service. They'll tell us if they want a female or male physician. They'll tell us how far they're willing to travel. They'll tell us stuff about the office. In some cities, people don't want to go somewhere where there's not on-site parking. You can tell us that. So really, through this virtual assistant-driven process, we're able to capture what matters to a member so that when we're giving them suggestions, it's actionable. Before we reach back out to a member, so this is the analysis is actually done by our concierge team. Our virtual assistant is there to own the communication. before we respond back to a member with a recommendation, we pick up the phone. We call those facilities, we call those providers to really confirm the things that a lot of times go unconfirmed. So simple stuff like, are you accepting new patients? More complicated stuff like if you're going to get blood work, we make sure that that office sends blood work to somewhere that's in network. If we're talking about a facility recommendation and we know a radiologist is going to be needed, we'll take the time to understand who the radiologists are at that facility so that the time of your operation aligns with the time that an in-network radiologist is available. So there's an evaluation that goes into this that really takes into account hidden costs of healthcare that often go really unknown and definitely unconsidered by the average consumer today. We also review prescriptions. So members talk to Joy and they tell us what are they taking, what their dosage is, what form it is in. And we do an analysis for them where we look at their plan design to figure out if there are better options. Maybe you're providing a specialty prescription program and this member's been buying this from a pharmacy and instead they could take advantage of that program through a mail order. We'll look at assistance programs. But I think on top of that, we'll also look at things like, are there therapeutic alternatives that would be more cost effective for this member? I'm sure there are people out there that maybe have been taking a brand drug because that was all that existed 10 years ago, and they've been doing the exact same thing every month since then. We're not really taking the time to evaluate that generics have come to market since then, and it may be more cost effective for them and the plan. And then on top of that, we're going to offer medical bill review services. So if something does go wrong and a member needs support to figure out why a bill costs what it does, or if something went wrong, our team's going to be there to go advocate on the member's behalf. So really, through this menu and through our virtual assistant and our concierge team, we want to be the first place that members go to make a healthcare decision so that we can set them off on the right path. You know, if we find out somebody has diabetes through the prescription that they tell us about, we're going to respond to them about, this is the best place you can be taking this prescription, but also, hey, you have this diabetes program within your plan design. Can we connect you with them? So this is maybe the one way to share our virtual assistant through a picture. But there's two main things that we rely on her for. We call her Joy. One is to provide our members with real-time access. So instead of wait times, when you click on something from our main menu, you can talk to Joy right away. You can tell her what your healthcare needs are and she can start guiding you. We're putting our concierge team in a position to guide you. So you see up there is an example of how we redirect folks to telemedicine. But I think more impactfully, Joy allows us to reach out to members. We can send push notifications and we can program Joy to hold a conversation with members so that we're not just sitting there waiting for them to remember that our application exists. So things that we can do from a proactive standpoint are, this is an example of a mental well-being campaign we ran where we reached out and asked folks if they were stressed. For folks that did say they were stressed, either all the time or sometimes, we offered our services to help them find a provider to address what was going on. We can obviously use this functionality for a lot of things, both on a kind of shotgun approach method, but also in a very personalized way. We know that as you age, your preventative care needs change. And so we understand your age through the eligibility file. And so the way that we engage you with, say, preventative care can change over time to be personalized to you. The way that we engage people can also become even more personalized through our integration with analytics providers. So actually, I'll get to that in a second. Just to kind of summarize how this application works, there's a play between our concierge team and our virtual assistant. So our virtual assistant handles 87% of the interactions that happen on our platform. We also have a phone number that folks can call, and we have the ability to live chat with our concierge team. So that's the 13% of interactions with members that you see going directly to our healthcare concierge team. But for the most part, people are talking with our virtual assistant. She's there to introduce folks to our services when they first log in. She's there to intake service requests when people need help. And she's also there to handle our outbound engagement. We maximize the time of our concierge team by letting them focus on the more complicated things, like fulfilling service requests. So I want to share a quick video here to kind of give you a sense of how all of this works from our concierge side. This is what our concierge team looks at. On the left-hand side is a history of all the chats that you've had with our team. On the right-hand side is the personal information that we have about each member. So in the middle here, you see the different views we have. So for each member, we're going to load in their specific insurance benefits, where they're at with their deductible. We get EMR records from our telemedicine provider. But what I'd like to focus on here is the claims piece. So when we're working with an analytics provider, we can get member-level information about claims. So we can take that claims information and make it very actionable through our platform. So the two main things that we're focused on with claims are cost containment opportunities and gaps in care. How can we help people better manage their health, but also make the right decision? So you see, as we scroll down here, we also have the underlying detail of what's going on with each of these members. So we integrate where our analytics provider is integrated with, say, a biometric screening program. We're going to get those details. And we're also going to get the raw claims data. Simple things we can do with raw claims data is we can set a threshold with a group that says, if a claim comes in over $2,000, we want to proactively reach out to engage them in a bill review. In this case, what we're showing is a member that could have saved money on a prescription. We saw that through the claims data, so we sent them a push notification. And then Joy's already programmed with how we can guide them to a better decision. So this person's taking Crestor, and it turns out that there's a coupon they could use to save $62 a month, or they can just wholesale switch over their prescription from Crestor to Lipitor and pay $0 by taking advantage of a specialty pharmacy program. So it's really, I think, through data points, either member-provided data points or data points that already exist, that we can change how people make decisions. We can proactively change their mode of behavior, which I think today for most healthcare consumers is to go to their primary care doctor or to any other physician and let them dictate their next step. And unfortunately, while those folks know a lot more than we do about the medical side of what a member needs, those folks aren't experts in insurance, and they certainly aren't experts in that person's benefits package. So I think we have a real opportunity to intercept that decision-making process by using technology, but also data to drive how that works. So just a quick overview of our architecture. What we do is we take your plan design, however complex that is, and we model it out in our system. We also take claims data and biometrics data, and we model that out. And through the eligibility file, we can map a member to their specific benefits, to their specific claims, to their specific biometrics. And through that mapping, we can provide a differentiated member experience when it comes to healthcare. I think what's really exciting is just the place that we're at in healthcare today. We're starting to share data more and more, working with companies like Cypress, where we get claims feed in a very repeatable fashion. Looking at the other providers and solutions that we've heard about, from a reference-based pricing standpoint, if we can get in front of members before they go to those facilities that don't work well with a reference-based pricing model, we can avoid all of the headaches that come with things like that. I think traditionally, we have tried to solve the market by starting from the supply side and saying, what can we do with the medical provider profession to make it more cost effective? So you see things like One Call, where they make radiology easier to use, more cost effective. But that value proposition to a member is so narrow that it's really hard for them to remember. So what we see is all of these best-in-class supply-side solutions out there. But from a member's perspective, the whole experience is still way too confusing. So if we can put a solution in a member's pocket that makes it really simple, and then integrate back with all of these best-in-class supply-side solutions and guide members in terms of how to interact with them, It really completes the puzzle of how we can change the outcomes of healthcare. I think when we look at where the market's headed, Gartner stated that by 2020, 85% of customer interactions will be managed by a human. I think this is something that we're seeing already, and it's something that we need to start adopting in healthcare. One of the main reasons why we do need to adopt that is the simple cost. I think Tom mentioned before I came up here that a lot of the solutions that we talk about are how do we address the 10% of people that spend the most on our plan. And I think part of the focus there is obvious. It's those folks that are driving the cost. But I think another piece of it is right now models are too expensive to address the whole population. And so we've decided to focus on the expensive ones. I think another thing Tom said yesterday was how do we start looking forward instead of in the rear view? I think by very nature, if we're providing solutions that are built for the people that are already sick, that has a little bit of a tinge to hindsight to it. I think the real and biggest long-term opportunity we have is to help people engage more with their preventative care so that we're catching diseases when they're in early stages rather than at expensive late stages. So that we're keeping people compliant with cholesterol medicine by looking at claims data to see, are they filling this prescription every 30 days? Or are they out of compliance? And so using a virtual assistant and using technology gives us the opportunity to do that. It's really cost effective for us to send a push notification and engage somebody with our virtual assistant and bring our concierge team when it's into the equation when they're needed. I think the reasons why this matter are pretty clear to everyone here. Prices vary a ton. Prices vary a ton. In networks, prices vary a ton. When you're talking about reference-based pricing providers, I think I heard Ryan say that they pay between 120% of Medicare all the way up to 240% sometimes. If we can make those conversations easier by steering people to those 120% facilities while also focusing on the outcomes for our members, there's just a massive opportunity here. But if we're depending on our members to do that on their own, I don't think the chances for this outcome are all that great. I think when we talk to people, most people can't even explain the simple terms. So asking them to untangle this really complicated system that we've created through Congress, I don't think that's. We've seen how that plays out. We've seen what's happened with healthcare over the last 20 years. And this is what's happening. There's wasted spend all over the place. And the only commonality here is that each of these categories starts with the consumer making a decision. They're the ones that go to a physician and say, yes, I want that procedure. Yes, I'll take that prescription. Yes, I'll pay that bill. I won't look at it. Healthcare is expensive. That's just what it is. This whole dynamic of healthcare being expensive, I believe, is what's leading to people disengaging with their health. They're afraid of the system because of things exactly like this. And because of that, they don't engage with their decision-making process. They don't look at quality, and they don't look at cost. So I think maybe one of the most impactful things of what we can do for all of you is we can make your strategies more effective. We spend a lot of time every year thinking through, what does my population look like? What specialty programs do I need to bring to address what's going on? Do I want to work with a direct primary care model? All of those strategies make a lot of sense when you're looking at the data points for your group, but they make a lot less sense when we roll them out to members. So if we can make it simple for members to understand what benefits you're giving them, and we can make it simple for them to use those benefits right by giving them a single mobile application where we communicate during enrollment, hey, we're going to capture what you elect. This is a really robust package, but just so you know, if you want to get the most out of it, just use this really simple app that we just gave you. It's part of our benefits package, and it's going to make sure that you're guided through the plan that we've designed. So really, if we can guide people to using narrow networks right, or using reference-based pricing right, or direct contracting, or mail order prescriptions, or telemedicine, or wellness, whatever you have in place, if we can integrate that and get in front of your members, you're going to see more informed utilization of your strategy. We also know that your strategy today is not what your strategy is going to be tomorrow. But if you put HealthJoy as the member face to this strategy, you can change the underlying aspects of it whenever it makes sense. And as long as people are continuing to use HealthJoy to make their decisions, and we're integrated with those changes that you're making, from a member perspective, that change is going to be seamless. They're not going to notice anything. They're just going to continue to rely on a virtual, data-driven experience to get the most out of their benefits. We know reporting is important. It's also something that's pretty native to what we do. We're a digital application. So we want to provide this level of insight with the folks that we work with. We have a benchmark of 50% of eligible employees activating their account within the first 30 days of us going live. So that will be the first time that we share data with any of our clients. We sit down and we share how many telemedicine visits have we driven through the application, how many providers have we found, how many facilities, bill reviews, what's the expected savings of the prescriptions and bill reviews and telemedicine utilization. But we're also going to check in to make sure that this program is being adopted at the rate that we expect it to be, because our motto is that if you start fast, you're probably going to stay fast. The best time to drive utilization is up front. It's not something that we can leave for folks and think that 180 days later, they're more likely to remember our service than 2 days after we launched. So it's really critical for us that we engage with HR during the launch process and after the launch process to make sure that we're seeing this type of utilization. And if we're not, we're going to take corrective action by working collaboratively with our HR champions. Our launch process is very thoughtful. We have templates that we send out to our HR champions, so they're the face of our communication. We hold a series of employee launch webinars where we demo our application live specific to their group, so they know what they're getting and they know why they should use it. And it's really what we found is that if we can share with people what our application does, it's kind of a no-brainer that they'll adopt it. I think most consumers in healthcare don't feel like they're very informed, and they don't feel very comfortable with the process. So if we can give them something that's much more comfortable, what we see is, again, 50% or more of folks are activating their account in the first 30 days. In fact, we just launched Cypress as a client. We're 21 days in. I looked at the numbers yesterday. 70% of the employee population has activated HealthJoy over those first 20 days. It's a quick case study with a client that we work with. They're a holding company. They run benefits centrally. And I think one of the struggles they had was they had 8 portfolio companies across 20 different states, and creating this centralized feel to what they were offering, creating a centralized benefits communication strategy was a real struggle for them. And so our product really resonated. Over the first 6 weeks, we saw 64% of this group activate their account. You can see the rest of the services that we were providing there. So the group is 1,600 employees in size, and 246 providers found over the first 6 weeks is what, like almost 15%. 723 prescriptions reviewed. That's something that we ask members to do up front. So the first time you come into our application, we ask members to tell us about their prescriptions they're taking. But I think what's most impactful here are the numbers on the right-hand side there. We drove a 7x ROI over those 6 weeks just through where we calculate savings, which is around telemedicine utilization and the redirection associated with it, bill reviews, and prescription savings. We actually don't calculate savings related to our facility and provider steerage because it's really difficult to understand what a member would have done otherwise. We can go and look at a market and say, what does a poor decision look like, and calculate the difference there, but that's not how we go about it. So really that savings is just from calculating 3 areas: prescriptions, bill review, and telemedicine. But I think what is even more impactful is this NPS score of 77 across this group. Is everyone familiar with what an NPS score is? Okay, I'll give a quick explanation. It's just a simple division equation. So people have the ability to rate the service that we deliver with each recommendation that we make. So a positive, they can either give us a positive, a neutral, or a negative review. The way you calculate this is a positive review, you take that sum, and you subtract the negative reviews, and that becomes your numerator. The denominator is everyone that gave you a review. So if we had 80 positive reviews, 10 negative, and 10 neutral, the numerator would be 70. The denominator is just the total amount of reviews. That would be 100, so that would have been a 70 NPS score. For this group, we had a 77 NPS score, which I think in any industry is pretty high. When you compare that to the healthcare industry, most carriers have an NPS of 19. And I think, simply what makes us different is that we're not only focused on saving folks money, we're focused on changing the member experience. If you can put a digital experience that makes healthcare easier for your members on top of whatever you already have in place, it's going to change how people perceive that benefits package. So that's what I wanted to share with you guys.